Cystitis is a type of urinary tract infection, or UTI. So how can you treat cystitis? To reduce the burning feeling, you can take paracetamol as a liquid or capsules by mouth. You can also get a powder or liquid with potassium citrate or sodium citrate from your pharmacy. You want to drink more water than usual. Try to have 1 cup of water per hour. Avoid drinks with caffeine like tea, coffee, and energy drinks. And avoid drinking alcohol or drinks which have a lot of sugar. So how do potassium citrate and sodium citrate work to help treat cystitis? Potassium citrate and sodium citrate make your pee less acidic, so it will hurt less every time you pee. So how do you take potassium citrate and or sodium citrate to help treat cystitis? You only need to take potassium citrate or sodium citrate. You do not need to take them at the same time. You need to mix the potassium citrate or sodium citrate with water. Potassium citrate and sodium citrate both come as either a liquid or powder sachets. So when you mix the powder or the liquid with water, you get a mixture that you have to drink every 8 hours. This means 3 times a day. And you need to do this for 2 days. So what if it doesn't help? If it doesn't help, you need to see a doctor or prescribing pharmacist to give you antibiotics like trimethoprim, nitrofurantoin, cefalexin, or amoxicillin. What if it's not a urinary tract infection, which is a UTI, or cystitis? If it's not a UTI or cystitis, you might have another type of condition, maybe an infection like thrush, or you might have dry or irritated skin in your genital area, or it could be something else. For example, if your urinary tract infection travels to your kidneys, this is called pyelonephritis. You will have a fever, which is a high body temperature, and you will feel really unwell. Sometimes there might be a bladder or kidney cancer, or sepsis, which is blood poisoning. Pyelonephritis, cancer, and sepsis all need urgent treatment, so please see your doctor. They will run some tests to check what you might have and offer treatment advice. So if you feel that you are getting a UTI or cystitis very often, or it's just not getting better, then you really do need to see your doctor. If you are over 65 years old and you take medicines to suppress your immune system, or you are pregnant, or you are a man with a penis, then you need to see your doctor as soon as possible if you think you have cystitis or a UTI, which is a urinary tract infection. So how can you prevent cystitis or a UTI? You need to make sure if you have sex that you pee afterwards. This can help to clear the tract so that there are no bacteria that can get inside. Do not use perfumes or soap to wash your genital area. You should ideally just use clean running water. Try to take a shower instead of a bath, because sitting in a bath with lots of soap or perfumed products can irritate the area and increase your chance of getting a UTI or cystitis. When you go to the toilet, if you do a poo, then wipe from the front to the back to avoid bacteria getting into your pee tube. Try to drink plenty of water during the day and avoid holding in your pee. When you do pee, pee until you feel your bladder is fully empty. Try to avoid drinking alcohol and eating sugary foods or drinking sugary drinks. So have fewer spoons of sugar in your tea, for example. If you wear pads in your underwear to catch pee or blood, then change these as soon as possible, especially if you notice they start to get quite full of pee. Avoid using spermicide if you have sex. For more information, check out the links in the description box below. Thank you for watching.